Thank you, and welcome back to the continuing coverage of Davos 2026 here on Davos Worldwide. We have just heard a little bit about the convergence of AI and outsourcing and the importance of creating efficiency using all the tools in the toolkit. So, moving on from there, we want to talk to a returning panel, which is Health Alliance, led by its CEO, Ken Flechler. And it will be moderated by Jevin. And I'm going to introduce this panel now. We have been blessed to have Jevin as a moderator. Is So Jevin, take a moment to introduce yourself, and then of course Ken and the panel. Have a wonderful day.
Wonderful. Thank you so very much. And to all of the attendees who's participating today at the Davos Worldwide Leaders Forum, thank you for tuning in for this incredible opportunity and these remarkable conversations that we are having. My name is Jevin Hodge. I serve as the Chief Executive Officer for Amplify Global Impact. What we are doing in Amplify is simple. We're connecting problem havers with problem solvers all across the globe, working with governments, nonprofits, educational institutions to advance progress, solve problems, and do strategic planning. In addition to that, I am a former member of the Arizona House of Representatives, representing the city of Tempe and Scottsdale, the president of the Booker T. Washington Child Development Center, Arizona's longest running early childhood education center, and the president of the NAACP of the East Valley, one of the nation's largest branches representing 2.2 million people in the greater Phoenix area. And today we are here to convene a conversation around digital health and what this means for the moment and the world currently. I'm joined by my very good friend, Mr. Ken Fletcher, the CEO of Health Alliance Global. Heal All. Heal All is a mission-driven healthcare organization dedicated to transforming access to emergency and urgent care through technology-enabled vital virtual care and real-time diagnostics. We're going to dive into that today and what that means. With over 3 decades of strategic leadership and experience across infrastructure, operations, administration, communications, and healthcare innovation, Ken leads Heal All's efforts to modernizing patient-centered care and expand access in underserved communities. And again, Ken, it is an absolute honor to be with you. More importantly, I'm proud to call you my friend, and I'm really looking forward to this conversation. So let's just jump right into it. Before we get into the fun stuff, tell us just a little bit about you, your journey. I gave a little bit of a snippet, but that doesn't cover, right, the journey that you've been on to get to Heal All. So just tell us a little bit about you.
Sure. I came up through actually the telecommunications side. Had the pleasure of working, starting off my career with one of John Malone's companies called TCI, where I came up in the training and the safety and compliance side of the company, the business, and then moved over to Comcast back when Comcast was a small Philadelphia company. We were on just a couple floors of 1500 Market down in Philadelphia, and was there while we went through a significant growth. Worked on the M&A team, but was over several different departments within the company. Left and joined Pike Electric, which was an electrical sector. So I moved from the communications to the electrical. Was the chief administrative officer of Pike Electric and was able to be a part of them as they grew both domestically and internationally to $1 billion company from the time that I was there. And then somewhat retired. And when I was retired, Bob Dudley, the former CEO of British Petroleum, reached out to me to come to him. He had started this company, this healthcare company, with really a mission to increase patient outcomes and increase accessibility, and by using innovation, reduce cost, because the U.S. leads the world by double digits in costs of healthcare. And so Bob asked me to come get involved, and I jumped in with both feet, and really make a difference.
Wow, Ken, I got to tell you, that is just a remarkable journey. And with that, You bring a level of experience to this mission that is comprehensive, that is diverse, and a completely different perspective. And I'm going to take you on a right turn here. I'm going to make a sharp right turn because I just want to get right into the conversation. I just saw you at the White House. I saw you participating, having some conversations with senior leadership. What was that all about? What's going on right now, and what brought you to the White House so that you were convening there?
Sure. On Friday, I had the honor of attending the Rural Health Roundtable, led by President Trump, with the Secretary Kennedy and Dr. Oz. And it really focused on the utilization of the $50 billion from the Big Beautiful Bill that the federal government's investing in the states. So they're putting $50 billion to really grow out rural health care. And they did ask each state to submit, and so each state got at least 1.5 billion.
Mhm.
Some states got more than two and a half, but out of the 50 billion, it's going to really make an impact to the rural areas. I mean, the problem with rural areas is utilization is 63% below what is in urban areas. So as you build out hospitals and other care centers, it's you in some locations in Arizona, for instance, where you are, you'll
Mhm.
drive 2 to 3 hours to get to an urgent care. And so we want to work with the administration and the different states in bringing healthcare to the patients.
Now, we know that Davos Worldwide, one of their global missions is expanding healthcare access and leveraging technologies, emerging technologies that are doing so. When you talk about rural healthcare, there is a direct connection to global healthcare with that. Speak to me about the importance of this moment. What does this mean? You're coming off of the heels of speaking at the White House about this issue, focusing on rural healthcare, but uh, tell us more. What does this mean for this moment? Where are we at, and how does rural healthcare relate? And what can we learn about what's happening in this moment?
Sure, I think you have to look at kind of go back to COVID. I
Hmm.
mean, COVID was really a game changer for telehealth. There has been several companies where you could pick up the phone and call your doctor, but during the lockdowns of COVID and just out of necessity, it really grew. And so with that growth, I think that afterwards, people started going back to their doctor, but a lot of the innovation was coming out of it. And so there was a lot of focus on the market and the innovation around telehealth and virtual health. And so all of a sudden, there's several companies that have developed really interesting products, and now they're being approved or, you know, from the FDA. And so you're able to use these platforms and other products to do, remote surgery to remote, we're doing remote diagnostics. We're placing diagnostic equipment in the locations and reducing transportations to hospitals. So, so that technology really spawned that. And I think you're also seeing that not in the US, but globally. I
Hmm.
understand the World Bank has an initiative that they're going to announce around rural health. And it's really not even rural health, it's really underserved communities. I know in South Carolina, where I'm from, in Charleston, they're looking at putting in remote healthcare system into communities where it's just so much traffic that in Phoenix you could drive 3 hours, but you're hundreds of miles away. But in some cities, it may take you an hour and a half to get across the city because of traffic, and especially if you're having to use public transportation or alternative means than a car, owning your own vehicle. So I think when you look at that, you're looking at underserved areas as well, and that could even extend to the correctional institutions and skilled nursing facilities, for instance, who we've been working with.
This is a perfect segue. Um, Tell us more about what Heal is doing right now, in this moment, especially as it pertains to rural healthcare. And when you think about addressing the emergent and immediate needs of expanding access.
Sure. So we have a platform, and we're really we seek out the best partners, and we're point to point. We have our own clinical staff, so we do have providers, and then what we have is our doctor triage mobile diagnostic unit, which you could see over my left or right, depending on how I'm coming across on the screen. Um, but that unit is placed into, for instance, a skilled nursing facility or a rural, what we're calling remote urgent care. And at that, you don't need a provider. So on that, you have the EKG, you have a urinalysis, you have an otoscope, you have a vital signs machine, and several other devices that they could do labs, and they could do it immediately with a nurse or even an EMT at the location. So, for instance, in skilled nursing facilities that we've been active in, we're involved with one, a VA facility in Virginia, and we're reducing 68% of the transports to the emergency room by providing, the necessary care at the point where the patient is. And so the idea is in a rural area that you could put these remote clinics, which is staffed minimally with either a nurse or even a paramedic, and you could be there to serve the small community.
Now, can you specifically talk about the difference between Heal All and telehealth? Because I think that folks confuse what Heal All is offering or these types of kiosks and what access really means.
Sure. When I think of telehealth, I think of a phone. I think you're picking up your phone, you're putting in the number, you're calling your doctor, and you say, "I have a sore throat, I have an earache." Ours are, if you go to our machine and you see our nurse or provider, or not provider, a nurse or EMT or paramedic, what they will do is they'll look in your throat with an otoscope, and the doctor's actually seeing that image, and it's going into your electronic medical records. In addition to, taking your temperature, taking your vitals, and they can then make a proper diagnosis for you for treatment. It's not, hey, I don't feel well. Can I get some Tamiflu or something like that? Or you need to go to the hospital. We're actually doing the diagnosis and having the provider on the other side talking to you and going through that visit. So it's that difference where you're actually having the diagnostics for yourself.
Mm-hmm. Absolutely. And when you can have that person with you, right, that has medical experience, you're seeing, you're feeling it. I mean, it just transforms what the care is. And you're keeping folks out of emergent care, right? You're keeping them out of the ER. And the ER can, for so many people, can be traumatizing, not to mention how expensive it is, not to mention the issues that come with everything that follows, where you might have a simple problem that can be addressed immediately right there, and you have access to medical professionals that have access to the equipments that they need to get the job done right there. And so, okay, now let's get back to rural health.
Sure.
We know about what Heal is doing. We know about the mission, and we know about the focus of the United States government at this point in time. How does Heal play a role specifically in this moment, specifically as it relates to rural health? What are you all doing? How are we moving the ball forward and advancing this issue?
Yeah, it's very interesting. The way the federal government has done it is let each state. So we have 50 different states doing 50 different programs. So New Jersey just came out with their responses were due yesterday, the 20th. Alaska is asking for partners to come in, and they'll start matching up partners. The way that we're approaching it is we're seeking great partners to work with to be able to provide a full service within the different states. One of the great partners that we have just agreed to is Stanford University. So Stanford's medical school and the Hoover Institute are partnering with us to look at the data that we'll have and to be able to provide reports back to the state and the federal government on, the different cases, both clinical side and the economics impact of the virtual health platform and these remote urgent cares. So we're building out these partnerships, but each state will be different. So it'll be really interesting to see how each state really attacks this. I think you're seeing responses and approaches from extreme
Yeah,
end to end.
I'm going to put you on the spot. Do you have any concerns about how the states are approaching this? Are there things that we could be doing better? How can what more could be happening in this moment?
Well, I think you're seeing a variety of things. I think you're seeing that some states, are starting to hire several people and full-time employees to manage a program that's supposed to last 5 years, where other states are completely outsourcing it to third parties. I think the states that will be the most successful are the ones that are really embracing innovation rather than embracing things that have worked in the past and played the doing the same thing. So I think you got to look at those innovation. And it's interesting, the federal government does have a clawback mechanism. So if you're not meeting the objectives, they can claw back the money from the states.
Walk me through the ideal partnership. So the states have the resources to implement to support rural healthcare. You all are stepping in as a strategic partner. What does it all look like when you put it all together?
So each state is coming out with a RH a request for proposals, and so we'll be submitting an RFP to the states with our partners and saying that based on what they're seeking, that we could, like in Arizona, we may put 25 mini clinics through the state, but one or two of them may be remote or mobile units that go through the Native American population that you have, and so community to community. So we'll be working with these states to look at their needs, and then we'll look at ways to solve their problems, but do it in a way that we can provide immediate impact as well as immediate data back to them so that they can measure how that impacted the state and see, what else can we do differently and work with them on their strategies.
And so we could be as creative as possible then, right? So like in Arizona, I have the Booker T. Washington Child Development Center. We can set up a kiosk at the early childhood center. I mean, a post office, a firehouse. I mean, really
Absolutely.
talk us through what this could be. Like, I mean, my wheels are turning about the endless opportunities that we have when you think about the rural communities, right? Some people drive 20 minutes to get to their mailbox. I mean, at the closest post office, you got folks that are driving an hour to get to the closest healthcare center, 45 minutes to get to a grocery store. So, I want to hear from you what is possible here?
So we've talked to a variety of states, and we've heard a variety of things. Some states have county health offices that are not being used fully. So the idea would be that we would convert part of the county health office into a mini clinic. Other areas that are even more remote have said, well, we have a paramedic at the fire station that's there 24 hours a day, or on the ambulance. Let's put one there and let people come to the fire station. Other things, like I said, the remote vehicle that you could drive, community to community, to putting a prefab facility in the front of a Dollar General store in rural areas.
Wow.
It
Wow.
could really be, it's really up to the states to determine where they
Mhm.
need it, and then we'll figure out how to place it there.
And the medical professional could be an off-duty EMT, right?
Absolutely, it could be yeah. So to use the cart that I have, the MDU behind me, it's a mobile. We call it the mobile diagnostic unit. Um, if you were sitting here and I had an episode, if you could push the call button, you're going to have a nurse and doctor come on, and they can explain to you how to handle it. So it is not a. It requires about 4 hours of training to use the device, and some basic first aid
Mhm.
knowledge, all the way down
So
to an EMT.
you're expanding jobs, you're
Mhm.
expanding access, you're expanding opportunity. The one thing we haven't talked about is cost. How is this? Is it works with the insurances? What does this mean for the consumer as they are participating?
Sure. So we bill according to CMS rates. It's covered by insurance. We interact. We're only business to business or business to government at the moment. So we work with the partners, and then like in a skilled nursing facility, the VA facility, we're we're reducing, as like I mentioned, about 68% of the transportations, and they're saving anywhere. The facility is saving direct and indirect costs between 30 and 50,000 a month, which is a facility that houses about 120 veterans. So if you look at just the impact of preventing you from going to the emergency room, And it's truly significant.
I mean, absolutely. I mean, that's enough to add extra, hands of support that you can have in the facility to make sure that the folks are getting the care, the attention, the support, right? The nurturance that they need to move forward. All right, Ken, you have a magic wand.
Yeah.
It's 5 years into the future. We've implemented the resources that from the Rural Health Transformation Act. What do you see, right? In a perfect world, blue sky, what is the perfect outcome here 5 years into the future after we've gotten a substantial amount of data? We're in rural communities across the country. What do you see as what's possible here?
I think you change the healthcare dynamic of rural areas. I think that the things that plague rural areas currently change and are addressed. The problem with rural areas is you just don't have great data, and this would allow you to collect great data and have a great institution analyze it and be able to work with the states and federal government to start addressing issues and problems beforehand. I think the like our mobile diagnostic unit as it sits today is really more of a pipeline. The different devices we have on it will change. I mean, I've seen different devices that allow you to scan someone for their blood pressure, look into their eyes. Those type of devices will eventually come on, and then you could interact with patients that way. But with the shortage of healthcare professionals, this allows you to use the healthcare professionals you have more efficiently and or interact with more people.
Now, with Davos being a worldwide organization, let's expand back out globally.
Absolutely.
We've learned, right, lessons learned from implementing in rural communities. We've transformed what rural healthcare looks like in the United States. What's possible globally? Where do you see the opportunities? Where do you see this going? And what's possible here?
So I didn't mention it, but one of our largest investors is Reliance Industries of India. And so we've had several discussions with them, and we've spent a lot of time in the GCC talking about, is this going to schools? Is it, how do you properly use this right now to really help with the healthcare system? In one country in the GCC, they're going to look at this to triage people before they go into the emergency room to decide, do you go into the emergency room or do you go into urgent care? And so working through the steps there. Um, but especially in like areas in the like Asia, where are the Philippines or where there's a lot of islands, having this on a remote island allows you to have the healthcare to them. And I think that's at the end of the day, you're looking for better patient outcomes and lower cost and you know, and technologies like this will lead the way.
I mean, and it's truly incredible, right? You think about global impact, right? You got a community in Latin America that has a small schoolhouse, and now you're expanding access there, right? You have a rural community in India where the kids are walking to you get to school, and now the families have access to quality care. This is transformational for our communities, right? Globally, for our fellow sisters and brothers around the world. Now, Ken, this is the leaders forum here, and so we have several other leaders here watching, and I'm confident that there's a partner or two that's sitting out in the wings right now, waiting for the right opportunity somewhere in rural America to partner with you. How can they get involved? How can they get on board with what they're doing, with what you all are doing, and walk us through how they can contact you? Because I know there's partners out there. Folks are itching at the bit to be part of this. What does this mean? Walk us through how they can get in contact and then how we can establish a partnership.
Yeah, with the guys like Bob Dudley and the leadership of Reliance Industries of India, having those two institutional leaders as our founders, it really allows us to really look broadly. And what we're looking for is innovation partners that not only you could use in the U.S., but if you have a technology thing that could apply to Africa or anywhere, like we're looking to integrate that into our company and our platform because we're point to point. So, we're agnostic about what we put at the point to look at diagnostics but if we can help the healthcare there to connect them to a remote clinician, we're all about partnering. And I love seeing the technology that's coming around the corner. It's truly amazing, and we want to be a part of it. And so I'm on LinkedIn. I think my email is pretty easy to find on our website, healall.com. And would love to hear from anybody who would be interested in working with us, partnering, whether they're in some way or another in healthcare to really make a difference.
I love this. When you truly think about the endless opportunities that Heal All presents, we're connecting communities that have been felt as if they've been forgotten and left behind. We're expanding access to all people so that they can ensure that they're getting high quality healthcare, access to physicians, access to, you think about everybody has a story, no matter where you come from, no matter who you are, of the cousin, the aunt, the uncle that had high blood pressure that turned into something else. Everyone has the story of the friend that didn't go to the doctor because it was too far away. Everyone has that story and can relate to that because you know someone, right, who, if they had access to healthcare, they would have participated with it and it could have had a different outcome, whatever the outcome would have been. So, Ken, I got to tell you, you're leading some transformational work. You're on the front end of something that is going to have substantial global impact. And quite frankly, I'm just going to put it out there, you're not changing lives. You're changing lineages, right? Because if now grandpa, right, that didn't go to the doctor in the middle of, rural Arizona because the hospital was 3 hours away, is now going up the street to the firehouse or the post office when he has a headache, his grandson is now going to see grandpa getting health care and getting care and now is going to prioritize his health care for their families moving forward. So this is what it takes. This is what it means to be on the front end, and this is what pioneering leadership looks like. And I got to commend you, my friend. You're doing some truly, truly remarkable work. We're landing the plane here, Ken, and we got just a few minutes here left. What is your call to action to the viewers that are viewing today?
Yeah, I think is really look at the how healthcare is really being invested in right now with the rural healthcare initiatives and really around innovation. And start trying it out, trying the different types. I know a lot of people still want to go to the doctor, but with the wearables that are out there, other things that help you diagnose, not literally diagnose yourself, but give you the red flags whether something's wrong, start embracing that because it'll change your life. It'll have early warnings to you. Then you could go to the doctor, if there's a need.
Wow, truly remarkable. Ladies and gentlemen, it has been an absolute honor to be with you all here today. Thank you to Davos Worldwide and the entire leadership team for convening us, bringing us all together. For the viewers out there, don't walk, run, sprint to the Heal All website because I know that there's a partner, there's a friend, there's a supporter, there's a community in need. We need you to get involved. Send Ken a note on LinkedIn because, a conversation leads to action. Follow me across all platforms at Jevin Hodge. We're going to continue doing great work. We're grateful to be here with each and every one of you. And I hope that you all have a beautiful rest of your day. Thank you, everybody, for
Thanks,
participating.
Kevin.
Great one.